How are you all? Okay, so I'm Dr. Anam, one of the doctor working with Mad Institutors. Okay, so basically, what we are going to discuss today is impact of UKMLA on exam preparation, which is a very high yield topic these days because everyone is worried about this. The GMC has recently changed this from Plab to UKMLA, and obviously it caused so much worry for us, like for international medical graduates. So basically, so let's discuss about this today. Okay. So, and I will also answer all your queries about this, and we will help you out. Okay. Okay. So, impact of UKMLA on exam preparation. Okay. Why it is not working? Screen share. Okay, so Mad Institutors. I'm from Mad Institutors, and it's our basically trusted e-learning platform where we empower doctors globally. Okay, so it is not like a conventional study pattern like we used to have this in our in our medical colleges. Okay, so basically it is your one-stop destination for your personalized assistance. Basically, we provide each individual, each of our student with personalized plan for study schedules, everything. We provide we help you guys in preparing for your all sorts of postgraduate exams like PLAB, MRCOG, MRCEM, MRCPCH. We have all kinds of doctors, we have all kinds of specialists available in our team to help you guys in each and every type of exam. Okay, so Marriage Tutors is committed to empowering you with the knowledge and skills you need for success, and it is golden opportunity to realign your skin and boost your confidence in real exam setting. Basically, what we do, we actually give you scenarios, and we actually give you those type of scenarios, and those type of scenarios. When you sit in the real exam, you don't feel like you don't feel the much difference between the what you are practicing and real exam, because most of the students find it difficult when they sit in the real exam. They feel like, oh, they do panic, and then they don't get success, and they don't score much because of this panic issues and because of this anxiety. So what we do, we trained you, and we empower you, and we help you to understand basically what is the exam and all stuff related to that. Okay, so then when you appear in your exam, you won't feel you don't feel like it's something new. You will feel like you can do it very easily, and then you will surely do that. So what are the objectives for today? So first of all, we will discuss about intro to UKMLA, and then we will discuss what is PLAB and what is MLA, and then how it impacts the exam preparation. Then we will discuss about UKMLA key highlights. Okay, then we will little bit discuss about the time management to solve the questions basically, and schedule for May 2024 and August 2024 exams for PLAB 1 students. So basically, for the development of medical professional aspiring to practice in the UK. Okay, so we all want to practice in the UK. Basically, because that's the reason we are practicing for PLAB, right? So GMC has announced the forthcoming introduction of the UK medical licensing assessment. Okay, medical licensing assessment UK based. Okay, so it basically what it does, it replaces the existing PLAB what we used to give. Okay, PLAB examination, it will replace this exam. And the UKMLA what aims to streamline the licensing process and ensure the highest standard of competence and professionalism among IMGs. Basically, they are trying to make it more standardized and generalized. Okay, so which will help us. Okay, so basically what has changed? Okay, so the transition is more of an administrative change. It doesn't impact your preparation much. Basically, the transition is more of an administrative changes. Previously, what we used to had, that IMGs, like jo international medical graduates, IMGs had to take the PLAB for the for GMC registration, and the UK and those individuals which live in the UK and they are UK graduates, they got the registration by just gaining the FY2 training. They don't have to give the PLAB exam. This PLAB exam was just for us for IMGs, but now UK has introduced this UK MLA for both of us. Like it is a common threshold for safe practice and standardization, like for both the classes, like for UK graduates and for IMGs. Then so basically it doesn't impact us more, but it will impact more for the UK graduates. Okay, so relax, guys. It's not like something completely changed, but there is little bit of difference which will we discuss, okay, further. So first of all, calm down and relax. Okay, there is nothing to worry about. There are little bit of things which are changed, and not and it doesn't impact our preparation for the exam. Okay, so when did basically it will start happening? Okay, give me a minute. Okay, give me a minute. Okay, sorry guys. Okay, so what were we discussing? So it is transition dates. Okay, so why it is not working? Yeah. So basically, MLA is scheduled to be implemented in the year 2024, and for PLAB 1, it will start from 8 August, like the exam which is on 8 August, and after that, it will be based on MLA. And for PLAB 2, all tests after and on from 17th May onwards. Like for PLAB 1, it will be changed from 8 August, and for PLAB 2 from 17th May. Okay, guys, any questions up till now? Any questions? Okay, let's discuss more. So language requirements will be same. What we used to give, like OET or IELTS, we need to give that. There is nothing change about the language requirement. Okay. Okay. So any questions up till now? You can ask me in chat, or I should proceed further. Okay. So basically, okay. So assessment structure, what will be the structure? So basically PLAB 1 is replaced by AKT, which is known as Applied Knowledge Test. Okay, PLAB 1 is changed to AKT and PLAB 2 is changed to CPSA. Okay, so what is AKT, Applied Knowledge Test? This is an MCQs based test which is similar to PLAB 1. What we used to prepare for PLAB 1, it is similar to that exam. But what is basically changed, like it is on screen test, like we used to have it written test in Plab 1, but now it is on screen on screen test, like online test, and aims to test your ability to apply your knowledge to different scenarios, right? And CPSA is like clinical and professional skills assessment. This is an OSCE exam similar to current Plab 2 format. So nothing is changed, just there is little bit things change. Name has changed, and like there little bit. Okay. So the exam follows the MLA content map available in the GMC website. The syllabus doesn't differ much from the Plab blueprint. Okay, the syllabus doesn't differ much from the Plab blueprint. So the exam takers test their experience won't they don't won't experience significantly impact. Okay, so there is a blueprint available in the GMC website. You can check that if you have booked the exams. Okay, so it is similar to Plab blueprint what we used to have, and the syllabus is same. And if you join our academy and like if you take our course, we will provide you with all the details, and all the questions will be based on the same blueprint MLA content map. According to the MLA content map, we will change our QBank according to this content map. Also, Plavable will also change this. So you don't need to worry about your exam preparation will be same. You just have to follow this blueprint, and also and the your general preparation like Plavable and all those things, and like our QBank. So exam stuff will be remain same. Okay. So okay, so there is a question. Is it confirmed that is on-screen test as some mails are being circulated? Is it still paper-based exam? Uh, if you are asking me confirmation, like it has mentioned on GMC website. Okay, so till now we can't say is it confirmed or not, but they are saying this. Basically, GMC has announced that okay, it is on screen tests. So and it doesn't make any difference. Okay, if it is not, but it will be on a screen test. If not now, then after that, like after August, it will be on screen test. So we do it doesn't make any much difference. But if you are asking, it is confirmed, so it is written on GMC website. So till date, it is confirmed. Any other question? AKT will be computerized, right? Yes, AKT will be computerized. In paper, you can change answer. Also, there is option in on-screen test to you can change the answer or you can switch the answer. Okay, so we have this facility available. Like if you are using the Plabable question bank or RQ bank, like we have this facility in mocks. When you give the mock, you have chance to change the answer. Okay, you can also skip the question and you can go back. Okay, so it doesn't make in that sense any much difference. Also, if you are discussing about asking about the changing the answer, so there is very limited time because 180 questions and 180 minutes, so you don't have much time to change the answers again and again. So you have to pick the answer once you are confirmed, and if you don't pick the answer on time, like skip that question for that time being, go to another question, and then when you complete the scenarios, come back to those questions which you skip, and then they will appear at in last. Like if it is on a screen test, it will appear, all the skips questions will appear later on after you complete the exam. Any other question? Okay, so there are some scenarios which students usually ask, okay, what we do. So if anyone has passed both the exam, like both parts of Plab 1 and Plab 2, for that person there is no change. Application approved within 2 years of passing Plab 1, like you can go for GMC registration and your application will be approved within 2 years of passing of Plab 2. Okay, so those individuals who have already passed Plab 1 and Plab 2, there is no change for those. Okay, if someone has passed Plab 1 but not attempted Plab 2, matlab someone has taken the Plab 1, now if they are concerning like I have to give the Plab 1, Plab 2, or I have to again give the AKT because I have cleared the Plab 1. So in this case, if you have passed Plab 1, you have to take if you have not attempted the Plab 2 yet. So what you do, you will take the CPSA within Plab 1's validity period. Like same Plab 2, Plab you have to take the CPSA, just the name is changed after Plab 1. Okay, you don't have to give AKT again. If you have passed Plab 1, you have to give the CPSA and within the validity period of Plab 1, which is 3 years. This is also for Plab 2, same scenario. Okay, like if someone has cleared Plab 1, he has to give the Plab 2 within 3 years of passing Plab 1. So same for CPSA. Upon CPSA success, apply for registration within 2 years. Okay. Now, if someone has attempted Plab 1 but not passed, in this scenario, now he is going to sit for the AKT, that is applied knowledge test, within a specified attempts limit. Same time limit is for AKT and CPSA, which we used to have for Plab 1 and Plab 2. And upon AKT success, complete CPSA within AKT's validity period. Same thing, AKT and CPSA like Plab 1 and Plab 2. Okay. And if someone has passed Plab 1 and attempted Plab 2 but not passed. Now, if someone has attempted Plab 2 and not passed, now he has to take the CPSA, similar to Plab 2, okay? But just the MLA content map will change and everything will be same, okay? So then after completing the CPSA, he will apply for the registration within 2 years of CPSA success. Okay. So how it impacts the exam preparation? MLA content map outlines essential knowledge, skills, and behavior for UK practice. Okay, basically they are trying that IMGs and non-IMGs, like UK graduates, all practice the same knowledge, same skills, same behavior, which they want for UK practice. Okay, which they want for their country. So they want everyone is on same page. So that's why they are changing this. Plab Part 1 and Part 2 are specifically crafted to assess these identified areas. The test, standard, question types, and station will not undergo any changes. Okay, so I was saying this is most worrisome for UK graduates, not for us, not for IMTs. Candidates test day experience will remain consistent with the current practice. Introduction of the content map doesn't affect the preparation candidates have already undertaken for the test. This is all written on the GMC website, so you don't have to worry about all this. Okay, you just have to practice and follow the right guidelines, follow the right map, and follow the right content. Okay, and you don't need to worry about UKMLA or its Plab or this and this, but you just have to stick to the right guidance. I always say stick to the right guidance and right material. Okay, this is very important, and we are here to provide you support from your day one till your exam date. Okay, so we will provide you all the support, all the guidance you need, all the question banks, all the questions, all the recalls. We will give you all the things. Okay, any questions? So up till now we have discussed about UKMLA. Okay, if any questions related to UKMLA, you can ask now. Then we switch to another objective. Okay. There is a question, can we give UKMLA or Plab before house job or without experience? You can give, yes. You just need a medical degree, like degree for your MBBS. You don't need to have a house job or you don't need to have a house job or internship experience, okay? So you can give UKMLA or Plab before your house job. Yes, you can give. But you need medical degree to book the exam. For that you need. Okay, give any other question, right? Can we give yeah. Ma'am, then what is the difference between Plab and UKMLA? Means what is the purpose of changing exam? I heard the UK graduates have to give the UKMLA, then this is only difference. Yeah, major difference is basically they are not changing, they are gradually changing it. Okay, so basically major difference is for UK graduates, and for us it will change like it, but it will change time to time. Like we will going to it will not affect our preparation basically. So they are changing very gradually, very slowly. Then it doesn't affect our preparation, but they will change. The change will standardize the process, and they want to make it more standard, uh, uh, like that. Okay, so it is written on their website. Okay. Okay, so any other question? Ma'am, should we get plavable subscription? Have they modified it according to UK MLA content, ma'am? Yes, yeah, they have modified that. Okay. Yeah, Plabable is also modified. Our QBank is also modified for that, so you don't need to worry about that. Okay, so any other question? Could you please explain the timeline that we will need to follow? Is that same as Plab 1 and Plab 2 then F5 program, or is there any new way around it? No, it's same. It's same. Like we have to give the Plab 1 and then Plab 2 like this, then AKT and then CPSA, and then you will enter in the UK at FI2 level. Okay, so it's the same. Uh, yes, Aksa, what question? You can switch on your audio. Ma'am, is it same price as big? Yeah, it's same price. Price is not changed. Price is same. Price is same. Okay.
Hello.
Yeah. Yes, Aksa.
Assalamu alaikum. So
Walaikum
my question is that they're saying in their website that the student will experience minimum change in the exam. They are not saying that they will be the change of UKMLA will not be same for the students. They're saying like the student will experience minimum change over there. It's mean that they will change a bit of the exam, isn't it?
Yeah, they will change a bit, but it will not impact much because obviously the material is same. The blueprint is nothing. The blueprint has minimal changes. Okay, so we will modify our QBank and Plabable will modify the QBank according to that. Okay, so you can change the what has changed. You can follow the blueprint. Okay, so if
Mhm.
you cover the blueprint content map like MLA content map, all the scenarios there, if you cover those, you don't need to worry about that.
Can we say this exam could be a little bit harder than the Plab?
No, it's not harder than the Plab because the content is same. Okay, so
Mm-hmm.
what they just want, they will introduce like ethical topics and they will introduce the like their standard protocols. They just want that.
Oh, all right. Thank you.
No problem. I want to join FY1 level, so AKT and CP exam will be mandatory. Yes, you have to give the exam. Other than those, you can't get the GMC registration. You cannot work in the UK without GMC registration. Okay, so you have to give the AKT and CPS exam for joining at any level. Okay, or you can go through MRCM pathway or MRCP pathway. That's another pathway. Okay, or you have to take the Plab pathway. Through any pathway, you have to clear the exam, and then you can only once you get the GMC registration, then you can only work in the UK. You can't join FY1 level without giving the AKT or CPS exam or having the GMC registration. Is it okay to get Plabable subscription using any of Plab or MLA subscription option, or do we need to stick to Plab only? Uh, Using any of Plab or MLA subscription option, or do we need to stick to Plab only? I'm not getting your question. Could you please specify, Dr. Jess? Could you please specify your question? Okay, so then let's move on. Okay, so time management to solve the questions. Basically, there are 180 questions for Plab 1 and 180 minutes. Okay, each question 1 minute. Okay, so what can you do? Try to cover, try to complete each question in 1 minute or less than 1 minute. There are few questions which are very easy. Like you see the question and you immediately take the answer. So in those questions, you will save the time for difficult questions. Like in some scenarios are long and options are very difficult, so you have to give more time to those questions. So what you do, uh, the easy one you will do early, and the for harder one you will save the time. So and it comes with practice. It only comes with practice. I am saying this, it only comes with practice. So the more you practice, the more the exam will be easier for you, and you will be able to manage the time, because Plab is not very difficult exam, but it is difficult exam, and you have to have the knowledge, and also you are very quick, and you should be very specific. Okay. So basically, this exam will check your judgments. How good is your clinical knowledge and clinical skills, basically. So you have to be very well prepared for solving the questions. If you are well prepared, you won't find it difficult to finish each question in 1 minute. Okay. So basically, what we suggest for to our students, like for 1 minute, like 30 seconds for scenario understanding and 30 seconds for options exploring. So basically, you divide this on roughly, but it's totally depend upon you. Okay. Also, there is a tip to finish the pool at least twice. Okay, basically, if you done the Plavable or QBank, any QBank, at least twice, then you are, and you also do and also you cover the mocks, and the more you practice, the more the more you confident, and then you will be able to manage the time, because I must say time management is the key to pass the exam. This exam is basically uh, very but because it is more like to manage the time. Okay. So because if in the end you have so many questions and you have less time, you will be panicking, and you won't be able to choose the right answer, and then at the end you might leave some questions unfilled, unattempted. So for better for better score, you need to practice more and more and more. And I must say, at least finish the question pool at least twice, at least twice. Okay, so ma'am, I am MBBS student of 6th Prof. When should I start preparing for Plab? Would be best for me. You have to start preparation in your final year, okay? Before final year, it's not ideal to start the preparation. In final year, you should start the preparation, and then start off at the start of house job, and end of his house job, you can give the exam, okay? Any other question? Or I should, okay. Uh, Wait. Uh, okay, so Plabable is showing two options, Plab and MLA. What do we need to go with? You have to go with MLA. Okay, you have to go with MLA if you are if your exam in August. Okay, if your exam is in May, so you have to take the Plab. Okay. Okay. So any other question? I okay. So in this July, I will get my MBBS degree. Then when I can give UKMLA or Plab, like if I apply in July, when will be my exam date or month? Okay, so after getting your MBBS degree, if you it depends if you have cleared your English language exam or not. If you have already given that exam and you have your result of your English language, proficiency exam, so you can apply, you can book the exam as soon as possible. You can give any time when you want after your completion of your MBBS degree or having the English exam result. Okay. Okay. So any other questions you can ask? Let's move further. Okay. So resources for a quick preparation, like we have I've discussed in my last webinar, like Plab 1 keys, they are very good for concepts. Okay. You should start with Plab 1 keys, at least do it once. Okay. When you do one chapter from Plab 1 keys, then you should take a Q bank. I'll highly recommend that, because we structured this question bank like the actual exam. So you should do the Mad Institutors Q bank and then Plabable Q bank, and at the end, after you cover these things, at least do these both things, like Mad Institutors Q bank and Plabable Q bank at least twice. Okay, so you will be pro you will be very confident, and then you will do the plabbable big mocks. And when you do the recalls and plabbable big mocks, then these are big mocks and the recalls. These are like actual exam. And if you score well in these big mocks, plabbable big mocks and recalls, okay? If you score good in these mocks, you are very good to go for the exam, okay? This will give you your assessment, okay? But for doing good in these exams, you need to do all these things, okay? And I must say, at least give yourself, if you are doing job or you have any other responsibility, at least give yourself uh, 5 to 6 months time. Or if you have very less time, but if you are not doing job or anything, you can do in 2 to 3 months time, but with very good like with very good time management and with very good schedule. We also provide a schedule, personalized schedule will be available for personalized schedule will be available, okay? We also provide this, and you can start your preparation with us, take resources from us, and have a look on sample schedule. I can show you the sample schedule which we give to our premium students. So they will like we can tailor the schedule according to the students needs, okay? We can give individualized attention to each and every student, and we help you. We want you to pass the exam. Okay, this is the basically sample schedule, like like if this is for May exam, like so you can see first you have to cover emergency medicine, GIT, and genetic concept from Plab 1 keys. Then we give you next day for the SBAs from Plabable and for marriage tutors. Like when we try we this is for one student, okay? So we try to cover each and every we try to cover each and every section at least twice before the exam. And then we also at the end we also provide days for playable big mocks and recalls, so it will then complete whole of your syllabus, and then you will be good to go for the exam, okay? So I must say, follow these like tab one keys for concepts. At least do it once. Once you done the chapter from like plab one key. Like suppose if you are doing emergency medicine, do emergency medicine plab one keys first. Then do these two banks. Okay, marriage tutors and plabable Q bank. If you are good, if you are scoring good, then switch to another. Then start second chapter like cardiology or let's say GID. Okay, then when you cover all the subjects and all the sections from these three resources, then at the end do the plabable big mocks, okay? Also plabable QBank also has some mocks, okay? So do those also, and at the end, at the very end, do the big mocks. They are high yield, okay? So they are similar to real exams, okay? So after doing all this stuff, you will be good to go. And if you can assess yourself by doing these, okay? And we will also give you some tips and so how can you score more in your exam, okay? So I have this some questions with me to interact with you guys, to show you what is Pleb 1 basically, or AKT. Okay, ma'am, some are saying that booking slots for Pleb 1 is tough as many as booking slots too fast, so we can get slot, we can't get slot. Is it true? Yes, it is very difficult these days, but it's not like you can't get the slots, but you have to prepare. You have to decide, and you have to decide early when you want the exam. If like in these days, at least you have to have your English exam result or like MBBS degree at least 6 months before your exam. Okay, so like you have to decide early to get your desired date. Okay, so like GMC just released the seats, I think last month, or it is releasing on 14 March. I don't remember exactly. Okay, I will tell you on the group. Okay, so basically, if you have your English test result and your MBS degree, you can book the slots for coming year. Okay, so you have at least six months or 1 year time to book the exam. Okay, so do we have any other question? it is difficult to get the seat, but you will get the seat eventually, okay? You need to give some time. Or in the meantime, you can start preparation. Simple. Also, okay. So let's discuss this scenario. A 45-year-old man was admitted to the ward and Hartmann solution was administered in a peripheral IV cannula. After half an hour, his upper limb became swollen, boggy, and cool to touch. There is pain reported at the puncture site. There is no skin discoloration. There is pain and swollen and boggy and cool to touch. What is the most appropriate action? Okay, so tell me the answer in chat box. What you should do. Okay, yes. Yes, she's saying A. Yes, it's right. Stop the solution, remove the cannula, and lift the arm. Okay, so basically you need the concept, and we will have there is explanation also given in the scenarios. So basically, what happened here? There is oozing from the cannula, and it has punctured the eye. When there is puncture site, there is oozing, blood coming out from that part, and then this caused this. So you have to be very uh, you have to be very sharp, and you have to look the age. First of all, you look the age, okay, and what happened, okay. So you have to pick all the hallmark features which are showing, okay. So yes, stop the solution, remove the cannula, and lift the arm. This is the right answer. Okay, next question. A 10-year-old is brought in by the ambulance after having been rescued from a house fire. There is a soot in his mouth and he has difficult breathing. What is the single most appropriate management? So, what is the single most appropriate? So, first check the age of the child, like 10-year-old, okay, and he's rescued from house fire. So, what can happen here? There is soot in his mouth and he has difficult breathing. So what is the single most appropriate management? The question is also giving you hint. So you can refer to burn unit, tracheal intubation, cricothyroidotomy, IPPV, or and administer 100% oxygen by face mask. So what is the answer for this? Someone is saying B, someone is saying E. Look, why there is confusion between B and E. So tell me why there they are asking most appropriate management, not the first line management. If they ask first line management here, so we will choose the E. Here they are not asking the first line management. They are saying most appropriate, like most definitive management. In this case, most definitive management means tracheal intubation, that is B. So here you get confused, okay? So this is very important to read the question carefully. What are they asking? Both are right. We will give the 100% oxygen by face mask. And first we will do this, but they are not asking this. They are asking the most appropriate management. In this case, as already soot in his mouth and he has difficult breathing. Like if we give the 100% oxygen, but in a meantime, in the short span of time, he will develop he won't recover and he will develop this difficult breathing because his airways collapse and airways completely filled with this soot and he won't be able to breathe. So we need to intubate him first, okay? We need to intubate him. So there is most appropriate management in this case would be tracheal intubation. So here is the confusion. Next, okay. 17-year-old girl visits the clinic with complaint of sore throat. Okay. 17-year-old girl for sore throat. Upon examination, she exhibits bilaterally enlarged tonsils accompanied by tender cervical lymphadenopathy. This marks her seventh episode of tonsillitis within past year, causing her to miss college days due to recurrent sore throats. Her center score is 3 by 4, leading to prescription of penicillin 5. What alternative cause of management should be considered? Let's answer this, guys. What is the answer? C. And what is the reason for C? C, right. Okay, so answer is C because this is the seventh episode. So it tests your knowledge. Okay, seventh episode in 1 year means it is the indication for tonsillectomy. It is given in the NICE guidelines. If someone develops 7 episodes per year in past 1 year, so he has to refer for tonsillectomy. In this case, it is written in the guideline. Okay, so the more you read, the more you are ready for the exam. Okay, so let's check. Okay, so the answer, 17-year-old girl direct to ENT for potential tonsillectomy consideration. Tonsillectomies are less common today, reflecting increased awareness of potential complications and modest benefit. However, in this case, the patient aligns with the referral criteria specified by NICE. Okay. Okay, so and last, I want to share that we have this surprise for you guys. Like we will conduct the 5 days recalls workshop for our premium students just before the exam. Like you have exam in your May, so we will decide the days and we will let you know about our 5 days recalls workshop in which we will discuss all the recalls. So be prepared for that and ready for that. Any questions so far? Yes, because no, because she has recurrent infections. Yes, recurrent infections, but there are certain rules. Okay, if she has 6 episode, or let's say if she has 3 or 4 episodes per year, we don't recommend her tonsillectomy. Okay, there is a certain guidelines for everything. In UK, they follow the guidelines for each and everything. You need to know those. Okay, any other questions so far? Also, we have a website where we have our QBank, so you can check those. You can check that also. You can take the subscription for that also. Okay. Okay, so I'm ending the meeting. If you have any queries, you can ask me. Okay, ma'am, I was I was sixth prof student. When is better for me to finish IELTS for English exam? We will do medical college, medical degree at month of June. Maybe I will get medical degree at month of June. You are sixth prof student, like what is your prof system? Like I don't know, you are following the annual system or like semester system. So if you're getting your medical degree in June, so you should give the OET as soon as possible so that when GMC release your seat release seats next time, you will be able to book the exam. Okay, so give the OET by June. So, and then in June you will have your degree, medical degree. So after June, then GMC will release anytime because they don't mention before they can release the seats anytime in the year. Okay, so as say they are releasing in March, and after that they will release after 3 or 5 months time, 3 to 6 months time. So yes, you should have your medical degree and your OET result by June, so you can book the Plab exam. Okay, semester system. Okay. Okay, thank you so much. If you have any other queries, you can ask. Thank you. Let's end the session.
Thank you so much, ma'am, for the wonderful session. Hope to see you again.